Hello, good afternoon. Good afternoon, my dear students. I hope you remember today we're going to deal with some of the gastrointestinal problems. And now onwards, almost week after week, every Friday, we'll be discussing the epidemiology and prevention of the gastrointestinal tract infections, which are of public health importance. We may not be dealing with the problems which are rare, but we will be dealing with some of the diseases which are of public health importance. So when we talk about the gastrointestinal problems, the most common gastrointestinal problem nowadays available throughout the world, it's globally significant that most of the people may be suffering from this disease at least once or twice in a year. And it is such a simple and mild problem. People do not bother much about it, but still the long-term effects of this particular disease may be very much important. So today I am going to discuss with you the salient features of a very significant syndrome which is popularly called as food poisoning. Okay? Now I just want to highlight on this particular terminology, food poisoning. Why it is called poison? Is it really a poison or some sort of a misnomer? Misnomer means it is something given to it by mistake, right? Is there any poison in the food, or you add some poison to the food and then somebody consumes this food? It's called as food poison. No, it is not like that. It is a contamination of the food which occurs very commonly in public health practices. And it is usually, it's not in one or two instances. It's many people are involved at a time. That's why we are more worried. Say, for instance, you go for a marriage party and you are enjoying a lot there with your friends and all these things. And you go for lunch or dinner. So almost you enjoy that dinner or lunch. And after a span of a couple of hours, suddenly you start getting abdominal pain. And you have to go for purging, which becomes very urgent. And then after purging, again you get the urge to go again and again. It continues. So you are somewhere else attending a party and suddenly you are stuck up with a problem and you are caught unaware. This is what exactly I mean poison. That means a food which is contaminated affects you like a poison. Poison is a very rapidly affecting substance or event, rapidly affecting event. So that's why it is called as food poisoning. So let us try to define exactly what is meant by food poisoning. Okay, food poisoning is not one particular disease. Several diseases are clubbed together into one term known as food poisoning. That's why it's called as a syndrome. It's a group of disorders which are put under one umbrella known as food poisoning. Is it clear? So it's a syndrome consisting of many diseases. And then bacteria are involved, organisms are sometimes, other agents are involved, sometimes viral organisms are involved, or it may be because of toxins. So the agent factors are plenty, not one, but so many agents. Bacteria are there, some fungi are there, toxins are there. So all these substances, all these organisms put together cause almost a similar type of a disease, which we call it as food poisoning. But what is the exact difference between our usual diarrhea, vomiting, gastroenteritis, and food poisoning? This is the point which I would like to tell you very clearly. What is the difference between the usual gastroenteritis and food poisoning? The difference is same type of symptoms are seen in a group of people. A large number of people may affect it. Sometimes what happens in a school, there is a lunch given to the school children. Maybe 1,000 or 2,000 children are taking that food, and suddenly 400, 300, 400 or 500 children are down with diarrhea, dysentery, and also vomitings. This is a typical description of food poisoning. A large number of people are affected, and all these people, if you go into the details, they give you a history of consumption of food, contaminated food. So to define what is food poisoning, you can note down food poisoning is defined as a syndrome caused by various bacteria, other agents, or their toxins with similar symptoms in a group of people with a history of contaminated food consumption. This is the typical definition of food poisoning. So, if you in future don't make a mistake of saying food poisoning, you eat some food in a hotel and you say food poisoning. It is not always a food poisoning. Maybe that food which is consumed by you is contaminated, but rest are not having any problems at all. So unnecessarily, a complaint is lodged against him, against the hotel person, saying that it is food poisoning. Sometimes what happens is you have consumed something else before going to the hotel. Okay, you must have taken some other food, or you are visiting 2 or 3 hotels, and morning you had breakfast in a hotel, and then after about 1 or 2 hours again you go for snacking, and then suddenly you develop gastrointestinal symptoms. How can we justify saying that one particular hotel is having contaminated food? So it is so difficult to pinpoint. You should be able to prove that large number of people who are taking food from the same hotel where you suffered gastrointestinal symptoms are also having a similar symptoms, and all of them have consumed the same type of food, and which is contaminated. Sometimes what happens, food is consumed and you may eat some non-vegetarian food. Some other people eat vegetarian food, and most often a non-vegetarian food very badly contaminated when compared to the vegetarian food. So the same hotel where they are serving both veg and non-veg material dishes. Only some people who have consumed non-veg material the food, they may develop symptoms, others may not develop symptoms. So it is very complex type of a definition where we say food poisoning. But the most important point you should remember is that a large number of people are affected. One, and all these people are affected, they give a history of consumption of contaminated food. Then only we can call it as. Why I'm so much particular telling you is that we cannot unnecessarily incriminate people saying that the food consumed is contaminated. Now coming to the types of food poisoning, there are several types of food poisoning. I said bacteria, other agents, and also the toxins. All of these things can cause food. But let us think about the most common types of food poisoning. First is the infective agents and toxic agents. The food poisoning caused by infective agents and toxic agents. The infective agents include viruses, bacteria, and parasites. There are several viruses causing the food poisoning, but bacteria is more common. Salmonella type are the most common type of food poisoning cases. salmonella, not typhi, salmonella, other organisms. And amoebiasis can cause food poisoning when it is consumed in a small quantity. Giardiasis can cause food poisoning when it is consumed. It's not always a dysentery, but sometimes it may be food poisoning. So there are several infective agents. Out of that, we always think about salmonella group of organisms, and also some parasites which can cause food poisoning. The toxic agents include preformed bacterial toxins. And sometimes you may consume poisonous mushrooms and exotic foods. Some exotic foods, you are visiting a forest and you find a very nicely colored fruit there, and you think it is edible, and suddenly you start eating that one. That food may cause a food poisoning because it may have some chemicals which are allergic to the gut. Similarly, if you are eating a food material with a lots of pesticides in that, again it can cause strange fruits and strange vegetables which are occurring in the wild, not in the normal. Especially this happens to people who are hunters. They are very much tired and they don't have anything to eat there in the forest, and suddenly they see some fruit which they think it is edible, and they start eating it and get into a major problem of food poisoning. So these are some of the types of food poisoning, are broadly divided into food poisoning due to infective agents and food poisoning due to toxic agents. And sometimes it's associated with the consumption of fishes which are contaminated with mercury compounds, and that mercury compounds can cause rapid purging. Now let us concentrate more on the infective origins, that is the organisms causing the disease. So two things which you have to remember is Staphylococcus and Streptococcus. Salmonella, Bacillus cereus. These are the most common type of organisms. Campylobacter and Clostridium welshi. Clostridium botulism and E. coli. Shigella and Vibrio cholera. Vibrio cholera causes cholera, but in atypical presentation of Vibrio cholera, you may get gastroenteritis, which is like a food poisoning. So out of that, I would like to give a lot of emphasis on Staphylococcus, which is the most common one. Streptococcus also very common. Salmonella is very. These are three important organisms which are often involved in food poisoning. Others are also there, but you have to remember these two things as a first preference. Whenever you are trying to investigate the food poisoning cases, you have to think of Staphylococcus, Streptococcus, and Salmonella. These are three important. Again, I told you, Salmonella, typhi is not very much involved. Salmonella, other organisms. Salmonella organisms are so many Salmonella organisms are there. Others are more important. And one of the important things which you have to mention is Clostridium botulinum. It causes a fatal type of food poisoning, whereas all other things may not develop cause fatal type, but botulism is of highly significant. Again, Shigella food poisoning is sometimes severe. Staphylococcus food poisoning sometimes are severe, and E. coli it doesn't cause much. Only mild symptoms are always seen here. Okay, so these are the different types of organisms which are involved in the food poisoning. Let us try to think about the host factors. What are the host factors in food poisoning? Very important. And if you remember these things, you will not become a victim of food poisoning. Age group. Which age group is very commonly involved in the food poisoning? Those are active age group. The age group the younger age group, who are actually outside. Most often they are working, and they are most often out of their houses. So they have the high risk of getting the food poisoning. Similarly, those people, hostile people living in hostels, there's a possibility. And children going to the school, they're also school going age is also. So what I'm trying to tell you is that people who are staying at home, most of the women and people above 60 years and children below 4 or 5 years, they're all staying at home. So they're at a low risk of getting food poisoning because they don't go out so often. Whenever the age group which is active, they are going out, they are at a risk of getting into this problem. Gender, again, the most important gender is male because more males are working when compared to the females. So the males are at high risk of getting food poisoning. Occupation. The occupation where there is more chances of eating outside food, especially the software engineers. They are most often they eat outside, and the occupation where they are similarly the mess workers. The mess workers are at a risk of getting the food poisoning. Addictions. Some people have got the addiction of eating outside. This is a very bad addiction I've seen in some people. They just crave to eat outside. They find out some sort of an event, some sort of an excuse to eat outside. Okay, this addiction leads to more and more of food poisoning in these people. Frequent travelers. There are politicians and people, business people who are traveling so frequently. They are also at a high risk of getting the food poisoning. So frequent travelers is a very important host factor. Low socioeconomic status. The low socioeconomic status where they cannot afford to eat quality food, they cannot afford to eat food which is just prepared. They may start eating food which is leftover. This side of people who cannot afford even to preserve the food that they are consuming, they are at high risk of getting the food poisoning. Then we have ignorance. There are a lot of people who knowing fully well that food can cause food poisoning, they still take it because thinking that nothing will happen. Ignorance. Something now a lot of people are doing for COVID also. They are advised to use mask, they are advised to keep distance, and a lot of people, including the institutions where you find a lot of learned people, they start saying that no, nothing happens. This is a clear-cut instance of ignorance. Ignorance can cause a lot of damage, not only food poisoning, but so many other diseases. Ignorance is a root cause. So try to remove that ignorance. And storage facilities. Many times what happens is the storage facilities are not adequate. And even the storage facilities are there, they're not working properly. Suppose a large amount of food is left off after dinner. So we cannot throw that so big amount of food material. So we start storing it inside the fridge. But fridge is also filled up. So what we do? We just keep some of the food materials outside. We say that we'll eat tomorrow. So when the storage facilities are not proper, the food which is kept outside is at a risk of developing the organisms inside, and they can cause more and more of damage to our intestinal tract. So storage facilities are very, very important. Not only storage of the cooked foods, storage of the raw foods also very important. This is highly important for the non-vegetarians. because non-vegetarian food at high risk of getting food poisoning. So should we take double care when you are using non-vegetarian, including milk and eggs. Awareness. Many people are not aware of food poisoning problems. That's why lack of awareness is also very important. People they are not aware that if they are consuming stored food, improperly stored food, they can get into the problems of food poisoning. Then dietary habits. The dietary habits, especially non-vegetarian. I have a special caution to all the non-vegetarian. Personally, I am against non-vegetarian food. Right? You just think about our Hindu culture. Many people, if they are outside, they try to avoid non-vegetarian food. I've seen a lot of my friends who are non-vegetarians. When they come out, they say no non-vegetarian. I ask them why. Is it because you are getting sentimental about non-vegetarian? No, they say most of the non-vegetarian foods are contaminated when we are eating outside. They strictly avoid non-vegetarian food when they go outside. It's a very good practice, and all of you should adopt it, right? So non-vegetarian food is high risk of getting into. Non-vegetarianism is a real risk not only for food poisoning, many diseases. When COVID, a non-vegetarian food is important. If you stop eating non-vegetarian food or you try to reduce your non-vegetarian food, you can prevent more than 20 or 30 diseases which can cause death of the people. Lot of diseases which are now occurring in the entire globe, sometimes going to the level of pandemic, are because of eating non-vegetarian food. Mad cow disease and all these things. Okay, so I can give you any number of examples where non-vegetarian food is involved in various types of diseases. Out of that, food poisoning is one very important example. So, my gentle advice to all of you is that if you are a non-vegetarian, we cannot say suddenly stop eating. Try to restrict yourselves. You know, we have got a religious practice. Whenever it is a festival day, whenever it is Saturday, we don't eat none. It is because of awareness among the ancestors. They also found that non-vegetarian food is at a high risk of getting. So they started restricting it and saying that in the name of God, don't eat non-vegetarian. So that's why the dietary habits are very important. If you are a non-vegetarian, you have to restrict your non-vegetarian food at least when you're going out. If you are a vegetarian, preserve your good habit. Don't unnecessarily convert yourself into non-vegetarian food, thinking that the vegetarian food doesn't have strength, which is a very absolutely a wrong type of thinking, that vegetarian food doesn't have the strength. I'm not going to discuss much about this because I've got a lot of PowerPoints where I have explained to the people the importance of vegetarian food. Again, when there is scarce of the food, we tend to keep the food material, and there's a possibility of getting contamination. Especially scarcity of food makes you eat something which is already rotten, right? So you are eating that food knowing fully, ignore again. There's an ignorance factor involved. So these are the various host factors. To give you some of the important host factors, the age is important, the gender is important, the occupation is important, and also it's important that your food habits and all these things should be taken care of if you are really trying to avoid food poisoning. And many times you have the habit of eating in different hotels, so better you don't go to many hotels. If it is a must, you have to eat outside. Try to eat in one specific hotel so that you are getting only one microorganism. If you are eating too many hotels, you are getting too many microorganisms. So that is one advice I can give you. Stick to one hotel, and the hotel where you are eating has not caused much damage to your intestinal system. You stick to that hotel. You will be more healthy than eating in several hotels. Now let us see the environmental factors. Wherever there is a fly breeding, there is a high risk of getting food poisoning. Fly is on, you know what a fly is doing? It sits on the fecal material and you are eating nearby, and immediately it is fascinated by the smell of your food. It is fascinated by the smell of the fecal material. It's also equally fascinated by the smell of your food. So wherever organic material is there, it comes. So immediately after sitting on the fecal material, it comes and sits on your rice or some other materials which are put in a plate, and it has got a very bad habit of cleaning its body. The fly has got a very bad habit of cleaning its body, and also it has got a very bad habit of uh, feeding habit. That is, it always it doesn't have that saliva inside, so it vomits on the food and digests the food outside, and again it sucks the food which is digested outside. So this is how the fly can cause. One is by cleaning off its body parts, and the second is by means of spitting on the food which contains a lot of organisms, and also it has got a lot of organisms sticking on its legs, so it cleans its legs and the wings also. So in that process, the organisms get deposited on the food that you are eating. Now, the point is, are you sure that immediately after the housefly sitting on your food, you are getting food poisoning? No, it is not like that. The fly has come on your food, and the food is stored for some more time. You are not eating that food. The fly has visited your food, and the food is kept there outside without the fridge. And during that 2 or 3 hours time of gap, what happens is the organisms which are deposited on the food by the fly, they multiply into millions and millions of organisms. Then you get into problem of food poisons. Okay, so fly breeding is an important environmental factor. The second one is overcrowding. Wherever there's an overcrowding, there's a possibility of food poisoning, because food contamination is more in overcrowded places. Hot and humid climates. And you know very well that most of the organisms, they multiply whenever there's hot and humid climates. Local customs. Sometimes what happens is local customs are there which prompt you, which force you to eat some food materials which are very badly preserved. I am not against temples, but sometimes what happens in the temples also, there is that tirtha is given. If the tirtha is not properly preserved, you may drink that food material and the liquid which is there in the temple for the sake of religious practices. Sometimes the prasada and the tirtha, both the things may be contaminated. It can give rise to the food poisoning. So be careful about it. I am not against the religious practices, but if the religious practices are done thinking that God is there to save me, it may not help. Soil pollution, if the pollution, there is a frequent outdoor defecation and soil is highly polluted, that is a place where the organisms are there that can be transmitted easily. Lack of food safety measures. There are a lot of hotels, if you are eating some food materials in a hotel, make a point, you would like to go to the kitchen and also the place where the food is being prepared, and you find that majority of the hotels, majority of the hostels, the food safety measures are not adequate. So this can give rise to food poisoning. Unhygienic food practices, again, these are important environmental factors. So these are all very important. If you can improve this environment into such a healthy life, healthy style, you will not get food poisoning. Okay, so we have completed agent factors, host factors, and environmental factors. If you understand the importance of all these factors probably will take care that you will not get into food poisoning. You see this picture, right? Can you count how many houseflies are there? Maybe hundreds of houseflies are there on the food material. And this is an excellent example for food poisoning in a hotel or in a very badly maintained hotels. So this picture is self-explanatory. I need not give you much details. What is this? Right? Bhaji, mirchi bhaji is being sold roadside, and there is no cover for this. A lot of dust may get into it, and houseflies may sit there. So this food you relish, right? If you order for a food, somebody may go and pick up this type of food and give it to you, and you are not aware that from where this food is brought. So you may be consuming this type of food, will get into food poisoning. Okay, so be careful about what you are eating. Now, clinical features are like any gastrointestinal disorders. Sometimes they rapidly develop, sometimes they may develop slowly. And they slowly increase in severity. Nausea and vomiting are the most common clinical features because it's related to the gastrointestinal system. Diarrhea and abdominal cramping may occur in some cases. Symptoms are not very severe or serious in most of the cases because most of the food poisoning cases are self-limiting. If it is a fatal problem, it may cause a lot of deaths, but usually in these conditions there is no fatality. But botulism is an exception because botulism is associated with a lot of neurological manifestations, and fatality in botulism may go up to 40%. Please remember this. What I'm trying to impress upon is that most of the food poisoning cases may not end up in death, but botulism, when once you get it, you get into problems of death and also serious nervous damage, neural damage. Okay, this picture shows very clearly the malaise, nausea, vomiting, fever, diarrhea, and abdominal pain. These are the common symptoms of the food poisoning cases. Now, I will be dealing with specific food poisoning cases because they are worth mentioning. Staphylococcus aureus. Usually, the origin of this organism is from cream-filled cakes, pies, and dairy products. And preformed toxin is available in the food. And usually it is associated with food handlers. The food handlers having pyoderma, right? They have got the skin lesions with pus. Okay, and this pus contains the Staphylococcus aureus. So when they are handling the food, the pus may enter into the food, and the Staphylococcus is released into the food materials, and they grow there and they multiply and they form a preformed toxin. So subsequently, after the food handler has prepared the food, he may heat it. Heat it just before. What happens is usually food is prepared. It is kept there. When a customer comes, it is heated and given. Even if the food is heated before giving food, the toxin cannot be destroyed. So it is not a thermo-resistant the toxin. So even after heating, just before eating, this particular toxin is not destroyed. So you may get the symptoms. It's a very rapid onset. Out of all the food poisoning cases, the most rapid onset is Staphylococcus aureus. Right? Sometimes it may be less than 1 hour. You have just consumed in a hotel, you're going to a meeting, or you're going to your house, it may take an half an hour. Even before you reach your house, you may get the symptoms of the diarrhea. Nausea, severe vomiting. Vomiting is a very important one in staphylococcus. Abdominal cramps, less important. Now, transmitted by uncooked food. Salmonella is transmitted by undercooked food. It is moderate illness. All age groups may be affected. Nausea, vomiting is a common thing. Crampy diarrhea. Loss of appetite is a very important feature. It is life-threatening illness. Okay? Sometimes it may cause death of the individual. Unlike staphylococcus rarely kills, whereas salmonella, the fatality may be about 3 to 4%. Now I am showing you something. After seeing this, can you guess why I am showing this? Right? It's a tinned food. So tinned food leads to a disease which is called as botulism. Clostridium botulinum causing botulism, right? So infants and young children are at high risk. Home packed foods are at high risk. Severe illness and CNS symptoms can occur. There may be paralysis, ptosis, sometimes the eyes are affected, blurred vision, slurring and overall weakness, breathing difficult. Sometimes it may cause the paralysis of the respiratory muscles and inability to move the arms and legs, and high case fatality rate. This is very important. We are more worried about botulism because it causes death of many people. And of late, in the Iraq war, they have used botulism and they have paralyzed and killed a lot of soldiers in the war. A biological war weapon it is. Now, finally, the most important aspect of today's topic is when once a food poisoning case occurs, it becomes obligatory, very much important for all of us, to see that further cases are not happening. We have to quickly diagnose the problem of food poisoning, and you should try to see that further damage is not happening, further damage is not occurring. So that's why there is a need to investigate food poisoning wherever it occurs. If it is happening in the hostels, immediately the doctors should go and investigate the matter so that it doesn't cause much problem to the remaining people in the hostel. So investigation of food poisoning is very important. The first and foremost, whenever you are asked to investigate the case of food poisoning, search for all cases and treat them. Many times what happens is, those with severe symptoms may come and approach you. So as far as triage is concerned, a triage always says that you have to give the treatment to the people who are severely affected. Yes, they may require IV fluids, and you may start giving the IV fluids to them, and then don't be satisfied with that. Immediately you have to send one team to the place where there is a food poisoning case occurred, and see that all the cases are searched and start treating. Otherwise, they may become severe and they may get into serious health problems. Search for all cases and treat them. You can frame one questionnaire, and from that questionnaire you come to know how many people are affected. Take detailed history of their food consumption, right? What type of food they have consumed, whether it is payasam or they have consumed that halwa, they have taken some dal, whatever it is, they have taken some non-vegetarian food, they have taken some curry. So you have to find out what types of food they have taken and if it is possible, how much quantity they have consumed. So this detailed history is important to pinpoint which food is uh, grossly contaminated, so that you can remove that particular food from consumption for future. If party is going on and some people are affected with food poisoning and there are still people eating the food in the party, and so we don't want those people to suffer from food poisoning. So this detailed history is important and you can easily pinpoint the food material which has caused that food poisoning instantly. You can track the food establishment. Some caterer has sent you the food, so you have to track that food establishment, and that food, the caterer must have sent the same food to several places. Now you are able to track one place where there are a lot of food poisoning cases, and the same food must have gone to several places. So you may get cases from there also. So before you get the cases from that place, you have to track that food establishment and ask those people, what are the places where this food has gone. He must have sent it to 10 or 15 places, and you can expect the food poisoning cases from all those places. So you track the food establishment, and once you are very much sure about the various places where it is, you start collecting samples of the food materials, which is most likely a contaminated one. Send these samples for the microbiological examination, so that immediately you get an idea, about the organism which is causing that disease. And at a later date, not immediately, you can use these food samples which are collected and preserved well. They can be used for the animal feeding experiments, and you can do some research on this also and submit a report. This is the detailed investigation of food poisoning, and it's a must, and each and every MBBS doctor should know how to investigate a food poisoning. It is not a specialist approach, it is not a specialist task, it is the task of a general practitioner. Okay, so one should be exposed how we have to investigate a instance of food poisoning, because you can save a lot of lives. You can save a lot of lives. It's a totally preventable one. When once a report is submitted, we come to know what are the various cooking practices. You can find out what are the cooking practices, and you can advise all the food handlers. You can arrange for a demonstration how to prepare healthy food. All these things should be done so that you future food poisoning cases do not occur. So this is all about the food poisoning, which is the very most common type of gastrointestinal system, and a lot of people get affected, but they ignore it because they get well soon. But this is a preventable morbidity, and always remember, we have to investigate whenever there is a food poisoning. Again, I want to tell you, food poisoning is not one simple disease, it's a syndrome. And in this syndrome, large number of people are affected. A large number of people are affected. And all these people are affected. When you ask them, they say that they have gone to one particular hotel. They have gone to one particular place, one marriage party, from where they have consumed that food. So this type of history should immediately alert you, and you should start investigating it and see that further morbidity and mortality is completely reduced. It is a totally a public health issue, and one should be very careful about it. So this is what I would like to tell you today, this food poisoning. If you have any questions to ask, you can ask me now. You can send in questions if you want. You can chat with me if you are interested. Otherwise, I'll close today's session.